travel has become an integral part of modern life, connecting people across continents for business, leisure, and personal reasons. However, spending extended periods in the confined environment of an airplane can pose various health risks, from minor discomforts to more serious concerns. Understanding these risks and implementing strategies to mitigate them is crucial for safeguarding health while traveling by air. This comprehensive exploration delves into the health risks associated with air travel and offers practical advice for minimizing these risks. Dehydration and dry cabin air. The low humidity levels in airplane cabins can lead to dehydration, dry skin, and discomfort in the eyes, nose, and throat. Mitigation strategies. Increase fluid intake, focusing on water and avoiding alcohol and caffeine, which can exacerbate dehydration. Use a saline nasal spray and lubricating eye drops to maintain moisture in the nasal passages and eyes. Apply a quality moisturizer to the skin to prevent dryness. Deep vein thrombosis, DVT. Prolonged immobility during long flights can increase the risk of deep vein thrombosis, DVT, a condition where blood clots form in deep veins, typically in the legs. Mitigation strategies. Perform in-seat exercises, such as foot circles and calf raises, and take regular walks down the aisle when possible. Wear compression socks to improve circulation in the legs. Stay hydrated and avoid crossing legs while seated to maintain good blood flow. Jet lag. Crossing multiple time zones disrupts the body's internal clock, leading to jet lag, characterized by fatigue, disturbed sleep, and digestive issues. Mitigation strategies. Gradually adjust your sleep schedule a few days before your trip to align more closely with the destination time zone. Use exposure to natural light to help reset your internal clock upon arrival. Consider short naps to alleviate fatigue without disrupting nighttime sleep. Exposure to germs and infections. The close proximity to other passengers and the recirculation of cabin air can increase exposure to germs and infectious diseases. Mitigation strategies. Practice good hand hygiene, washing hands frequently with soap and water, or using hand sanitizer. Use disinfecting wipes to clean tray tables, armrests, and other surfaces. Wear a face mask, especially during flu season or when traveling to areas with known outbreaks. Cabin pressure and ear discomfort. Changes in cabin pressure during takeoff and landing can cause ear discomfort or pain, known as barotrauma. Mitigation strategies. Yawn, swallow, or chew gum during ascent and descent to help equalize ear pressure. Use over-the-counter decongestant nasal sprays or oral decongestants if you have a cold or allergies, but consult a doctor before using these medications, especially if you have heart disease or high blood pressure. Consider wearing earplugs designed for air travel that slowly equalize the pressure against your eardrums. Cosmic radiation exposure. Frequent flyers and flight crew are exposed to higher levels of cosmic radiation, with potential long-term health implications. Mitigation strategies. Be aware of your cumulative exposure if you are a frequent flyer or work as aircrew, and consult with occupational health specialists for assessment and advice. Pregnant passengers should be especially cautious and discuss air travel with their healthcare provider. Food and water safety. Airplane food and water, including ice cubes, can sometimes be sources of gastrointestinal infections. Mitigation strategies. Opt for bottled water and avoid ice in drinks. Bring your own snacks or meals prepared with known safe ingredients, especially if you have food sensitivities or allergies. Motion sickness. Turbulence can cause motion sickness, characterized by nausea, dizziness, and vomiting. Mitigation strategies. Choose a seat over the wings where motion is felt less intensely. Focus on a fixed point or close your eyes to reduce the sense of motion. Consider over-the-counter motion sickness medications or acupressure bands, but be aware of potential drowsiness. Psychological stress. Air travel can be a source of significant stress, from fear of flying to the stress associated with delays, security checks, and other aspects of air travel. Mitigation strategies. Practice relaxation techniques such as deep breathing, meditation, or listening to calming music. Plan ahead to minimize last-minute rushes and allow ample time for security and boarding. Seek support from airline staff or fellow passengers if feeling overwhelmed. In conclusion, While air travel offers invaluable benefits in terms of connectivity and opportunities, it is not without its health risks. By understanding these risks and taking proactive steps to mitigate them, travelers can enjoy safer and more comfortable journeys. Implementing the strategies outlined above can help minimize the adverse effects of air travel on health, ensuring a more pleasant and health-conscious travel experience.